I must say that since the reforms began in 2011, there really isn't a lot of new information. That's not unique to Myanmar. It usually takes 2 or 3 years to catch up. But I think for those of you who've tried to get good information from Myanmar, the data are very dodgy. For each key indicator, you can find a broad range of estimates. I've tended to default to the United Nations system, but of course they depend on other sources. As we've already heard, research was really a dirty word in Myanmar prior to the reforms, unless it was done in a laboratory or perhaps a hospital ward. So there's very little in the way of research to verify the key indicators. But given that caveat, I think we can all agree that as a snapshot in 2010, they were very poor. Life expectancy at birth, again, in the Lancet series or an editorial on health in Burma only a year or two ago, the figure used by the Lancet was actually 56 years. Now, I can't find any support for that. But even at 64.5, if I compare each of those indicators with Australia, a relatively good performer in Thailand and a poorer country like Laos, then life expectancy is not good. It ranks 133rd in the world. Under 5 mortality, which is a key indicator for the Millennium Development Goals, the world ranking is 148. Likewise, infant mortality, 140. Maternal mortality ratio actually is better than Laos, a lot worse than Australia and Thailand, world ranking around 130. We just heard about the high rates of undernutrition. They are measured in 3 ways. 40% of children are short for their age, 30% are skinny for their age, and 11% are skinny for their height. These rank around about number 155 in terms of nutrition in the world. Yeah, I don't know how well you can see those, but you will see if Myanmar is to achieve those 2 health MDGs, the rate of improvement will have to accelerate significantly in the next 2 years. While communicable diseases contribute only around 30 to 35% of all deaths in Myanmar, they are the most preventable, given currently available, proven and affordable interventions. And you'll see down towards the bottom, well, at the bottom, Myanmar has the 2nd highest burden of communicable diseases in Southeast Asia, second only to Cambodia. And you'll see that most of those are preventable. You see about 1/3 of them are due to pneumonia. Around 2/3 of all new cases of malaria in the Greater Mekong subregion occur in Myanmar, and there the data are very, very unreliable, and the ranges are from like 1 million to 5 million cases a year. Very troubling, there is emerging resistance to the only effective drug that we have available at the moment near the Thai border, and that's been measured by the inability of that drug, artemisinin, to clear malaria parasites after 3 days of treatment. The tuberculosis prevalence was revised through a large national survey in 2010. You'll see it was almost doubled. And therefore the reported case detection rate, that's the number of cases of active TB diagnosed and treated, declined from what had been an incredible over 100% down to about 55%. Drug resistance to all drugs is also emerging in Myanmar, and particularly in prisons where it tends to be neglected and can only be treated in 2 places. In Yangon and Mandalay. So it means the poor really cannot access treatment without moving their whole family to Mandalay. Myanmar suffered a devastating epidemic of HIV in the early 1990s, which tended to be overlooked and neglected. I have been to villages in the south near Dawei, the port of Dawei, where most young men went out to be fishermen, where 25% of the adult population has died of HIV. I've also been to villages in Kachin State where in some districts almost every household has someone who injects drugs, and 30% of those are HIV infected. So there's an estimated 250,000, almost 250,000 people living with HIV. Personally, I think it's much higher. I think some of the assumptions that led to a 0.6% prevalence are not reliable. So you'll see in 2009 in female sex workers, 18% infected, men who have sex with men, 29%, people who inject drugs, 38%, prisoners, it's not known, but in my experience, it's very high. Now, Myanmar's been making considerable progress over the last 5 to 6 years, particularly with funding injected by the Three Diseases Fund for Burma. And you'll see rates have been declining, but in some groups have remained stubbornly the same. A recent Lancet paper on non-communicable diseases in Southeast Asia found, a little bit surprisingly, that death rates due to non-communicable diseases were higher in the poorer countries in Southeast Asia. And that's probably due to the fact that they lack the capacity to treat people with chronic heart disease, diabetes, cancer. So Myanmar, Laos and Cambodia had the highest rates. Around 60% of deaths in Myanmar were due to non-communicable diseases. Around 30% of those deaths are in young adults between the age of 15 and 59, and so therefore should be preventable. So this is just an indication that Myanmar is facing a double burden, so what WHO calls the unfinished agenda of communicable diseases plus non-communicable diseases. Now, this article found that of the risk factors like smoking, high blood pressure, lack of exercise, etc., only one was clearly related to affluence, and that was the prevalence of diabetes. And Myanmar's prevalence of 3.2% was the lowest in the region. We just heard how a large percentage of children are malnourished. Well, again, we have a double burden with 32% of adult men and 47% of women are overweight. So we have obesity or overweight on one hand and undernutrition on the other. Now, I tried to get data on the rates of injury-related deaths. I gave up, but one of our colleagues, Georgina Phillips, who may be more patient, may have better data. I found actually a 10-fold range of age-adjusted rates for injuries, somewhat confounded by Cyclone Nargis. So 2008 is around the last year I could find. Now, when we look at expenditure on healthcare, it's the snapshot in 2010 is truly awful. At that time, Myanmar spent in total $17 per capita on healthcare. That ranked 191 out of 193 in the world. Australia, by contrast, spends $3,670 per person per year. If you look at public health expenditure as a proportion of government expenditure, it had been declining to less than 1%. That ranks at 183 of those countries with data. Only the Democratic Republic of the Congo and Burundi are worse. Just a snapshot of Southeast Asia actually. Again, you will see that Myanmar had the lowest proportion of public expenditure, 11% in the Asian region. Now, just look at that middle row. In 2009-2010, the government spent around 18 cents per person on medical goods. That's drugs and other goods and services. So that buys around 3 capsules of a common antibiotic. So that's per person per year. So Myanmar is starting basically from the bottom of the world's rankings. I found Somalia spends more money on healthcare than Myanmar. Then add to that the very small amount of overseas development assistance. Myanmar in 2010 received $7 per capita, compared with much higher rates in other Southeast Asian countries. I think you all know about governance and corruption. Myanmar ranks 172 for corruption and a score of 25 out of 600 for world governance. Again, that puts it in the same ballpark as Afghanistan, North Korea, and Somalia. I'm not going to go through this organogram, but it's worth noting that Western donors have thus far only funded health services from the township downwards. So you'll see above that is a vast number of departments at the provincial or the state and division level, at the central level, that have not engaged at all with Western donors up until possibly soon. I've been on the board of the Three Diseases Fund since 2006. I think it did demonstrate through some very, very hard times that it was possible to efficiently conduct donor-funded activities with transparency. You'll see there the 7 donor partners included Australia. It ended up spending $115 million through 35 implementing partners, including 8 Burmese NGOs. And the achievements are significant. Many condoms, antiretroviral therapy to 22,000 people, large numbers of people treated for TB and malaria. So it's coming to an end. I don't have any solid new information, except that the Minister of Health has been saying some encouraging things about focusing on infant, child and maternal health, that rather than churn out more doctors and nurses, they will try and improve the quality of their services. But having said that, Myanmar's ratio of doctors, nurses and midwives per population is still very low. Now, the quadrupling of the health budget since 2011, so it sounds fantastic, has now put Myanmar ranked 174 in the world and mostly pays for our salaries. So my second last slide, Andrew, none of these prerequisites are specific for health. I think they're prerequisites for better human development. Accelerated economic growth has to be the key one. Resolution of ethnic conflicts, because people are still nervous. They still don't yet quite understand who calls the shots. Literally speaking, some military commanders are doing that. Greater engagement at higher levels between government and donors. I would think, why not be bold and aim for what all African leaders agreed at the Abuja conference 10 years ago, that the government should aim for 15% of its budget, rather than at the moment is 4%. Further strengthening of civil society, greater emphasis on human rights. These are not my priorities. They come from around 30 recommendations made at last year's Conference on Development Policy Options, with a special reference to education and health in Naypyidaw. Most of the recommendations focused on financing, healthcare financing, clearly, and human resource gaps. But in addition, strengthening information systems, broadening health research out of the laboratory and out of the hospital ward into communities, and more closely aligning or linking research to the development of policy. Thank you.